All right. Now, quickly, I want to go through a couple of medical questions for you.
Okay.
Again, just want to make sure that we qualify. I have a guaranteed issued plan that regardless of any pre-existing conditions, we can get you covered. So, again, let's just go through a series of questions. If you have any yeses, feel free to say yes. If you have any no's, feel free to say no on that. All right. First of all, are you? We're not married. Are you not pregnant? I'm assuming you're not an expectant parent, but you're also not in the process of adopting a child or anything along that lines.
No.
Okay. Great. Now let's only look back at the last 5 years and think about any of these conditions that you've received treatment for, been advised to receive treatment for. First of all, a heart disorder. Excluding mitral valve prolapse, surgically corrected atrial septal defect, ventricular septal defect, no. Had a stroke,
No.
Crohn's disease or ulcerative colitis,
No.
Liver disorder,
No.
kidney disorders,
No.
emphysema or chronic obstructive pulmonary disease.
No.
All right. How about diabetes?
No.
Okay. Cancers. How about any basal cell carcinomas? Okay. Alcoholism, chemical dependency, drug use.
Just on Saturdays.
Got it. We call that therapy. It is definitely needed, but we've never been advised by a doctor
No,
to
never.
go ahead and take a little less therapy. Great. How about multiple sclerosis?
No.
Tuberculosis?
No.
Any condition that resulted in bariatric surgery like a lap band, anything along that nature?
No.
And no AIDS or HIV? Great.
Sure.
Absolutely perfect there. Now I want to take a look back and see when was the last time you had to go to the doctor?
Probably over a year ago.
Okay, got it. And about 13, just right about a year ago? Okay, so we'll probably about February of '08. And what did you go into the doctor for at that point?
Had the flu.
Okay, perfect. That's flu season for sure. Were you prescribed anything at that point in time?
Tamiflu.
Tamiflu? I can see now you're completely recovered. That's a good thing. How about the doctor that you visited?
His name was Dr. Smith.
Okay. Do you happen to know his address or a phone number by chance?
I believe it's 101 Main Street.
Okay. And that's Fort Worth as well?
Yes.
All righty. I'll be able to find him online so I can get his phone number should an underwriter need that in good shape. Completely recovered from the flu. How about prior to that? When was the last time you went to the hospital, doctor or hospital?
About 2.5 years ago, I broke my arm.
Okay. So probably around October of '06?
Yeah, sounds about right.
Okay. How'd you break your arm?
Jumping over a fence, my wrist got caught between the fence and the pole.
Got it.
Snapped
Ooh.
it.
Wow, wow. That require surgery at all, or?
Did not.
Okay. All right. What was the besides the diagnosis? Any prescriptions that they gave you? Did they cast it? What kind of steps did they take?
They did give me pain meds were prescribed,
Okay.
and I was in a cast.
And completely recovered from that?
Yes.
No surgeries that they want to put pins in or anything along that line? Excellent. All righty. And where did you go to be seen at that point?
Baylor Medical.
Okay. Is that the one down in downtown Fort Worth as well?
Yes.
Okay. Excellent. Perfect. Besides that, taking a look back the last 5 years, any other trips to the hospital to see the doctor?
No.
Okay, great. Well, Mike, at this point, I need to do just a little bit of homework for myself. So we might take about a 5-minute break. If you need to get a cup of coffee, make a phone call or two. What I need to do is just, now that I've got a good snapshot of your physical status and your budget, I need to just educate myself just a little bit more We'll come back in about 5 minutes. We'll start going through the solution that I think is going to really help you out. I'm going to be real excited to show this to you. So let's take just about a 5-minute break, and I'll call you back in here in just a second. Sound good?
Yes, sir.
All right. Now at this